Hi, my name is Whitney Ham, and myself and my coworker, Alissa Molinelli, will be talking with you about employees with autism spectrum disorders, tips for educating employers and colleagues. Alissa and I have both worked with individuals with autism spectrum disorders for several years now. And what we have found is when introducing these individuals to the workplace, that oftentimes we get questions from both their employers, their supervisors, and their colleagues on best ways to interact with this individual, and also just questions about autism in general. So this presentation will give you a bit of a background on autism spectrum disorder and how it can present in the workplace, and then my coworker will go into more specific details about certain challenges that you may see in working with this individual and also strategies for success. So our topics: what is an autism spectrum disorder? What might it look like? Some challenges, and once again, some strategies for success. So first off, this is a pretty famous quote you see a lot. If you've met one person with autism, you've met one person with autism. We are really going to hammer this point home today, but autism is a spectrum, and there is a broad range of different personalities and unique characteristics, just as you see with yourself, your friends, your family. Everyone is a little different, and that's the same in working with someone with autism. So autism is a lifelong developmental disability. It is distinguished by difficulty with understanding social cues and facial expressions, inflexibility and discomfort with change, and difficulty adapting to new tasks and routines. Here we have a triad of the behavioral symptoms that you see with autism spectrum disorder. So all of these, it looks like a Venn diagram, all of these behavioral symptoms coexist, and they work together and present themselves in different ways. So the first one up top is social interaction, nonverbal social communication. Sometimes this is referred to as the hidden curriculum in working with individuals with autism. And the hidden curriculum might be something that with a typically developing individual, if we're all sitting there in the workplace, the break room, we're all talking about what we did this weekend or how we're really dreading the work day to day, and all of a sudden your supervisor walks in and everybody gets quiet, puts their cell phones away. Someone with autism might not understand those social cues, and they might just continue talking about how much they dislike work or they dislike what they're going to do today. Also, difficulty with peer relationships and social reciprocity. So the normal give and take that you have in a conversation with a friend can be difficult for someone with autism. They might not understand that, oh, this person is really shutting down and not understanding that they're sick of hearing me talk about Harry Potter or something like that. Also, patterns of behavior, repetitive patterns of behavior and interests. You might find that when you're working with your individuals that they go home every night and eat the exact same thing for dinner, for instance, spaghetti with butter and parsley, or they may watch the same movie every night. Some of this might be establishing the routine, which can sometimes brings comfort to individuals with autism. Also, repetitive patterns of interests. They might know everything there is to know about Godzilla or Yu-Gi-Oh cards. And also, the last one, communication. So an individual with autism may or may not have the ability to speak. They may be more verbal, they may have very simple verbal communication, yes, no, expressing a need to go to the bathroom or hunger. They may also use symbolic language. They may have an augmentative communication device, or they may use symbols that they press, for instance, to go to the bathroom or to express something that they need. Also, difficulties with pragmatic communication. This is just the normal grammatical rules that we follow in everyday life and communicating with other people. Things like where to insert articles. Some individuals with autism might say something like, Otis Spunkmeyer live in cafeteria, and things like that. So some demographics of autism. It is the fastest growing developmental disability. Because of this, with the increasing diagnostic rates, that's why it is becoming even more important to educate individuals out in the community about working with individuals with autism spectrum disorders. It is a spectrum, as we mentioned before. So the 5 disorders on the spectrum: autism spectrum disorder, PDD, NOS, pervasive developmental disorder not otherwise specified, Asperger's, Rett syndrome, and also childhood disintegrative disorder. So we wanted to mention here that the autism spectrum has actually, the disorder has changed now with the DSM-5. However, what we have run into out in the community is that culturally, the old definition of autism is still in place. So people still think of things like Asperger's or autism rather than what is going to happen in the DSM-5. So we felt like if you have questions about this and wanted to know more, to please refer to this website. But in working with individuals out in the workplace, oftentimes you will find that they still adhere to the old rules. So what the DSM-5 is saying is Rett syndrome Rett syndrome and Rett syndrome is going to be taken off, and PDD-NOS, Asperger's, and childhood disintegrative disorder are all going to go under autism spectrum disorder. In addition, 3 symptom categories are going to become 2. So it will be a communication social interaction disorder rather than having 2, and also add unusual sensory behavior to the criteria. So what might an autism spectrum disorder look like? It is an invisible disability. What we mean by that is when you see an individual walking by them, you might not know that they have autism. And that is a good thing because it can make inclusion easier. However, it can also make it more difficult for typically developing individuals, patrons of the workplace or coworkers and supervisors. It can make it harder for them to understand why the individual might be behaving the way that they are. Why do they think it's okay to tell me that I look horrible today? Or why are they completely breaking down because they can't find where their seafoam green marker has gone? It might look like, in the workplace, fear of a novel situation. As you know, when you go to work, things can be different every day that you go in. And you can't control for things that are going to happen. You can't control that a light is going to break or there might be construction going on next door. An individual with autism might react with fear to this new situation that they weren't expecting because comfort and routines can mean a lot to this individual. Difficulty communicating, both receptive communication and expressive communication. The individual might have a difficult time expressing their wants and needs, how they are feeling that day. If they are scared about these new changes in their routine, they may have a hard time telling that to you, and it might present itself very different than saying, hey, this construction's really bothering me today. I wish I had some headphones to put on. Also, receptive communication, taking it in and comprehending. Alissa is going to get more into some strategies for dealing with expressive and receptive communication issues. Also overwhelmed due to incoming sensory stimuli. Sensory integration and processing the smell of your coworker, maybe their new perfume, what someone's cooking in the microwave downstairs. All of these things can be hard for them to integrate and respond to at one time, and it can become overwhelming to an individual. And also behavioral challenges. We are going to, the second half of the presentation really gets into discussing some of the behavioral challenges that you may see with an individual, but just keep in mind that this behavior is not personally against you, it's communicating something to you. So it's important when you are introducing someone with autism into the workplace or performing coworker education that you really focus on some strengths of individuals with autism spectrum disorders because they are numerous. Individuals with autism can be excellent at recall for repetitive and routine tasks. Months can go by between learning something and then having to do it again in the workplace, and they can remember every single step. For instance, with one of our clients, they learned how to take apart a piece of machinery that had at least 50 different items. They then went on to complete 2 different internships in their work site. They came back 7 months later and remembered exactly how to do it again, which I found pretty amazing. Very good at remembering faces and names. A lot of our clients, if you tell them your phone number one time, we always say you say it once, you know it for life. You will be in that person's memory for good. Good at attending to the task at hand. What we find is that while we may get on Facebook, look at our cell phones, stop and have a 5-minute chit chat with one of our coworkers, Oftentimes our individuals with autism, once they are aware of their expectations on the job site, they get right to it. They like to know what they're working on, they like to know what's expected, how much they need to do of it, and they aren't going to necessarily be as distracted by normal everyday things like we would be. Attention to detail. Some of our individuals really thrive on data entry, and data entry, not making mistakes. We had someone that was working on computer entry, putting in addresses and names of many individuals out in the community that were actually making donations to the hospital. And not only would she correct the punctuation that was wrong, but she updated about 12,000 records, and her supervisor for the first few days would go after and make sure that everything had been put in once. And she said, finally, I just stopped doing it because I never had to make a correction. Motivated to complete their schedule, they can. We've found with our clients that they really feel a sense of accomplishment when they have finished a task and get to either come back and share it with classmates, friends, parents, or supervisors. Comforted with routines, as I've touched on before, and also honest and refreshing. A lot of times while you will work on social skills and what is appropriate and not appropriate to talk about in the workplace, sometimes their perception is just very refreshing and enjoyable. So here we have normal in quotation marks, and we really just want to stress the fact that everyone is an individual and everybody is different. And I think that we can all agree that normal, once you get to really know somebody, there's always something a little quirky or an interest that they may have that we find a little strange. So in relation to introducing an individual with autism to the workplace, we wanted to touch on disclosure of the disability. It is really important to sit down with this individual and perhaps their support staff and find out if they are open to disclosing their disability. And if they're not, then you need to find ways to work around that and how they would like to be supported. If they are open to disclosing their disability, I think it's important to sit down with the individual as well and talk about how they would like to disclose their disability. Would they like to have kind of an open discussion with their coworkers and supervisor, or would they like to sit down one-on-one with their employer and talk about their disability and what it might mean for them? Also, hobbies and interests. Some of the things that I mentioned earlier might seem somewhat childish, talking about Transformers or the Yu-Gi-Oh! Or Power Ranger cards. However, other individuals will sit there and read an entire book on history and World War II over their lunch break, and that's what they prefer to talk about. Hobbies and interests are different. We all know adults that are still interested in cars and trains, and same for individuals with autism spectrum disorders. Also, learning styles. Some individuals may be literate and they would prefer to have all of their supports written out for them, or perhaps on a PDA device, which fits in very well with society today. Or they may prefer picture schedules and other visual schedules rather than just having things written down. They may like to have you show them how to do it once, maybe outside of the workplace, and then they can go practice it on their own in the workplace without someone by their side. This is a good segue into preference for supports, the level. And this can go hand in hand with whether or not they've chosen to disclose their disability to their employer. But some individuals, particularly higher functioning individuals, may only like to meet with you outside of work to discuss how work was today or to practice a new task that they're learning. Other individuals might want you side by side, perhaps performing the task first or telling them how to do it, then showing them, and then doing it once for them so that they can watch, modeling, and then having them do it as well. And also, once again, type of supports, whether or not they want a visual support, whether or not they want it on a PDA, and things like that. So with this slide, my coworker is now going to come up and discuss some of the challenges and strategies for success in working with individuals with autism in the workplace.
I'm now going to be talking about breaking down the Venn diagram that Whitney had brought up before and talking about some of the challenges and strategies that could be successful in the workplace. The first one is communication challenges. Many times individuals with autism have problems with expressive language, things like expressing their needs, wants, preferences, and problems. Somebody we worked with wasn't feeling so great and he was having trouble describing that and just said, "Oh, my throat is feeling very sad." So we knew to go ahead and get some help. He was having a sore throat. Other times, the expression may not even be verbal and could be a nonverbal cue, such as not wanting to go through their schedule and the individual taking their schedule and flipping it over onto the desk. Other times, there are problems with receptive language, taking it in and comprehension, as well as, of course, the challenge of lack of verbal communication. So as Whitney had mentioned, some of the individuals we work with may use devices, augmentative communication devices, pictures, or gestures as their form of communication. Additionally, some people that we work with may have echolalia, where they are repeating what you have just said to them. So, good morning, hello, how are you? Good morning, hello, how are you? And others may sound like a little professor or an expert on a topic, or may be rattling off movie scripts that they have heard before, and that's oftentimes going to be memorization of things that they have heard before, knowing that when spoken to, I'm supposed to have something to say, so I'm going to say something that I've already heard before. Some of the strategies that we can use for communication is to speak with the individual and support staff first. As we've mentioned several times, these are individuals, and we want to find out what their individual preferences are. What is the best interaction method? Should I speak with this person? One of the ladies that I've worked with does not like to be touched, but when you work in a warm environment, somebody may come up and touch you on the shoulder, and you don't want to get the response of, do not touch me, and to be kind of bat it off. So it's best to talk to the family and the individual first and say, how do you want me to speak to you? What is going to be the most successful? Also, ask the employee to demonstrate their understanding of what you have asked them to do, whatever the instruction is. This can be done through clarification, or asking the person to show you what the understanding is, and provide time for there to be questions, for there to be processing and questions. And sometimes the question might not just come. There may be silence, and you may have to prompt the individual and say, do you have a question? Talk slowly and quietly. Again, we want to be calm. We want to be concise. So many of the words that I've already said today are far too much than what we need to use when talking to individuals with autism. We don't need to be, over the top. Just be direct, concrete. Billy, I need you to clean the isolette and then go out on the floors. So very clear, very direct instruction. A lot of the times, we'll use idioms, or just go ahead, clean that piece of equipment. It's going to be a piece of cake. Really? Where's the cake? So we don't want to use idioms and expressions and sarcasm because that's going to be interpreted in a very direct way, and so we want to be concrete and clear when we're giving direction. Also, with communicating, it's often very helpful to use visual supports to supplement the verbal communication. So in addition to the verbal communication, to have a visual support as well. Many of the times when we're working with individuals, we will provide them with a visual schedule. And so this can also tie in with communication strategies so that you can point and communicate that way. Again, give the employee a time to demonstrate their understanding. And as Whitney had mentioned before, a strategy that we use a lot of the time is tell the individual what's expected, show them what's expected, do it, and give them the opportunity to do that as well so that they can demonstrate understanding. Many of the individuals that we work with, again, have social challenges, and there can be difficulty reading social cues, facial expressions, and body language. Maybe unaware of social norms, especially in the workplace. Shaking hands, greetings, is this the type of atmosphere where we're going to hug? Some things that we come across, even just after a long weekend, coming back to work and saying, Whitney, I missed you, and Whitney just keeps on walking. So maybe giving instruction to say, when somebody says, I missed you, say, thank you, or I missed you too. Being unaware of others' perspectives, boundaries, personal space, private versus public, and appropriate versus inappropriate topics. What's okay to talk about at home versus what's okay to talk about in the break room. A lot of these kind of overlap. one of the individuals that we work with had a very difficult time understanding social norms, others' perspectives, and reading social cues. So working in a hospital, we were in an elevator, and there was a man in a wheelchair there who had been amputated. And when we're in the elevator, she keeps looking over at the man and wants to say something, and I'm going, mm-mm. And all of a sudden, we hear, well, I have my legs. And so that's, something that we wanted to address. And if the nonverbal and the other's perspective were there, we probably would have been able to get around that situation a little bit easier, or at least waited until the individual was off the elevator. What's okay to talk about at home versus what's okay to talk about in the break room? When you're at home and you have a conflict with your mom, then that's something that you really want to try to keep at home. A lot of the times we tell the people that we're working with to keep your social problems at home. When you get to work, put your work hat on, and it's time to be professional here. So when we're in the break room, it's okay to talk about sports or the weather or pop culture, what you're going to do this weekend. But we want to stay away from saying things like, well, I lost my computer time, so I bit my mom this weekend. Things like that, what's appropriate, what's inappropriate, talking about our personal needs can also be inappropriate. And again, we want to be really direct and say this is not an appropriate place to speak about this, and give the individual a time or an outlet where they could talk about that. Some social strategies that we use, again, are the concrete directions and expectations. Be clear and to the point. Social stories, how to handle social situations and concurrent feelings. So many of the people that we work with, we have written social stories for. A social story may be how to deal with something, an unusual or unfamiliar or uncomfortable situation, such as when your ride to work is late. So this is somewhere that you could go and rely on the job coach or the family member or support staff to write the social story, so that as the employer you shouldn't feel like you have to be coming up with this, but to write a story that would be read by the individual when I arrive to work. Even if I am late, I clock in, and so you go through the routine so that the individual reads it and can help them to process how to work through a social situation. Again, the use of modeling, role play, and practice is very important. We're going to say that in the workplace, this can be a great way to help the individual to be more successful. So if the individual's job requires them to speak with the public sometimes, to practice with them. Have them practice with their supervisor, coworkers, even family members. Role play and practice different situations and different circumstances so that the individual can learn how to respond in those situations. If it may not be so much as, if this happens, then this is how you solve the problem, but teaching the individual that if this happens, then the way that I solve the problem is by going to get a manager or going to get a nurse. And so practicing those type of things, as well as so much as practicing, how to shake hands, how to greet someone, how to smile when, and say, have a nice day. Another area is behavior challenges, and this can be very frustrating for employers and coworkers to deal with, because when an individual is exhibiting a behavior, this behavior serves a function, and it may feel like a personal attack or a way for the individual with autism to be disruptive in the workplace, but it's not intentional to hurt you. It's not an attack on the employer. It's not to offend the coworker. Every behavior that we have serves a function. Even when I sit here and say nothing, I am communicating something. So we have to figure out, what is this behavior communicating to me? Generally, the functions of behavior are attention, to escape from something, to obtain something tangible, for sensory input, or attenuation of pain. So we need to work with the individual to say, to look at them, observe what's happening, and then try to figure out, is the individual trying to gain attention by exhibiting this behavior? Are they saying that they can't do it because they're trying to escape from the task because they don't want to do it, or maybe they do not completely understand what they need to do? Do they want to gain something tangible, something to eat, anything like that? Sensory input, the way that something feels, or attenuation of pain, again, maybe communicating to you that something's bothering me. something hurts, and this is my way of communicating that to you, because again, we have to remember that verbal and expressive communication may be limited. So some strategies when people are exhibiting challenging behaviors at work. I'm going to get a little bit more into workplace behaviors and challenges as well, but some quick ones would be the first and next card. Oftentimes, we have found that transition periods are the most difficult for individuals with autism. So that time when you just clock into work, or lunchtime, or have a break, what we've noticed is that these are unstructured periods of time, and the individuals that we work with, particularly individuals with autism, really like to have structure and routine. It's the comfort of knowing what's going to come next. So a strategy to use would be to have a card, and on one side it says first and one side says next, and just to write first, you are going to clock in, next, you are going to wash your hands. So it just is a visual or written support to say this is what you're going to do first, this is what you're going to do next, and it can help to comfort the individual and to establish that routine. Another is the pre-MEC principle, which we may call grandma's rule. So that can say, if you complete all of your schedule today, then at the end of the day, you can have 15 minutes to talk to your favorite coworker about the sports game that happened last night. The pre-MEC principle can be used with a tangible reinforcement as well, but if the individual wants to, if the behavior, we've decided that the behavior is to seek attention, then we want to use the pre-MEC principle and couple it with whatever function the individual was trying to achieve. So if it's for attention, if you do this, then you will get attention from this person. If it's for to escape from something, if you do this, then maybe you don't have to do it the next day or something like that. So, or again, it could be something tangible. So we want to give choices to the individual as well. These are adults, employees, and when we are employees, a lot of the time we have some control over what we're doing in a day. We may not have that much, but if there's a list of things that need to get done in a day, give the individual some input so that they can choose what their schedule is going to be. That's going to create, a sense of ownership and like, this is my job. I chose this. It can be very empowering for the individual to feel like they know what's coming and they chose what's coming next. And behavior strategies, again, we want to use clarification. Clarification may be something to say that in this particular environment, we need to clarify that this is a rule for this environment. This is a rule that at home you can, you can talk for 25 minutes about Yu-Gi-Oh! However, in this environment, we are going to have to talk about Yu-Gi-Oh! For 1 minute and then get back to work. So clarifying, what the expectations are. This is an area of sensory challenges, and this is really difficult for me to explain, but we found an article. It's from a book called 10 Things Every Child with Autism Wishes You Knew by Ellen Nussbaum, and I'm going to read a little piece from this to describe what sensory challenges might feel like. My sensory perceptions are disordered. Sensory integration may be the most difficult aspect of autism to understand, but it is arguably the most critical. This means that the ordinary sights, sounds, smells, tastes, and touches of every day that you may not even notice can be downright painful for me. The very environment in which I have to live often seems hostile. I may appear withdrawn or belligerent to you, but I am really just trying to defend myself. Here is why a simple trip to the grocery store may be hell for me. My hearing may be hyperacute. Dozens of people are talking at once. The loudspeaker booms today's special, music whines from the sound system, cash registers beep and cough, a coffee grinder is chugging, the meat cutter screeches, babies wail, carts creak, the fluorescent lighting hums, my brain can't filter all the input, and I'm in overload. My sense of smell may be highly sensitive. Because I am visually oriented, this may be my first sense to become overstimulated. The fluorescent light is not only too bright, it buzzes and hums. The room seems to pulsate and it hurts my eyes. All this affects my vestibular and proprioceptive senses, and now I can't even tell where my body is in space. So imagine what that would feel like going to the grocery store, which really is a simple routine trip a lot of the time, and feeling all of this input that can be so disruptive to an individual. One of the ladies that I worked with worked in an area that had been painted yellow. And I talked to her one day and said, you know, how's everything going? And she said, oh, it's fine. I finally got used to the new paint. I said, what do you mean? She said, well, I came in one day and the walls were painted blue. It was killing my eyes. Now, I think they chose blue because that's generally a calming color, but for this particular individual, it was really disruptive and actually hurt her eyes. So processing, as you heard, processing incoming sensory stimuli could be very difficult. So we want you to consider what does your workplace feel like? What are the noises, the smells, what type of people, how many people are around in your workplace, what machines are making noise? Are there photocopiers going off? Are all different people talking? Did somebody come in wearing, you know, a cologne or a lotion today, and what is the lighting? So consider your workplace and consider what smells and what senses, you know, the individual might be experiencing there. Processing a novel situation can also be difficult. Again, we've said that the people that we're working with like routine, so we want to tell them what's coming. So if being in the job requires that you put on plastic gloves or have a uniform that may be itchy or requires you to wear a belt, we want to prepare the individual that this situation may be uncomfortable and to practice and prepare for what's coming, as well as responding to the sensory environment. Some strategies that we could use to alleviate some of these sensory challenges include structuring the physical environment. Again, considering your space, what really needs to be there. Organize it. Reduce clutter in the area so that each space serves a function. The same way that me saying too many words can be distracting or overwhelming is the same way that a space that has too many things that don't serve a function can be overwhelming for an individual. And again, consider your physical barriers, lights, have the individual maybe work with similar staff that they already know or have an introduction to the person if there's a way. I mean, sometimes the fluorescent lights can be really awful. So if there's a way to structure the area where the person's working with a lamp, even a lamp that they can bring in from home to provide comfort, that can be helpful as well. Limit the amount of people in the space or in the immediate area. It's great to work around coworkers. We understand that. We want the individuals to be socially integrated as well. But the chatter that can come with that can be a lot. And if there's too much happening, that might be something to consider. Again, that's going to be very individualized because somebody else might like to work around a lot of people in their space. Again, we want to be aware of how you approach the individual. So as I mentioned before, if somebody doesn't like to be touched, then you don't want to go ahead and touch them when you're first meeting them. So approach the individual from the front and speak to them clearly instead of shouting from across the room, hey, I need you to go make a copy over there, Whitney, because what she might have only heard was Whitney. So be aware of how you're approaching the individual. And again with this, you know, obtain input from the caregivers and support staff on what sensory strategies that may be helpful at home or in other environments. Coping mechanisms can be something very simple, even just having a Ziploc bag and something, you know, to move your hand on. But again, that's going to be very individualized. So it's a good time to seek support from the people who know the individual best, as well as the individual, to find out from them what's going to be calming. In addition to the behavioral, sensory, and communication challenges and strategies that we've already talked about today, I wanted to highlight some specific workplace challenges that may arise. And these are ones that we have experienced across many different environments. The first one is accepting correction. Then flexibility, which can be both-sided, meaning that it's flexibility on the side of the individual as well as flexibility on the side of the employer. Understanding criticism versus constructive criticism, understanding the professional hierarchy and the culture of the workplace, and then challenges with personnel. So some strategies that we have used, this might be a good place to include the job coach and support staff on designing and implementing any of these strategies, but these have been helpful in dealing with many of the challenges. The first one is behavioral rehearsal. And I'm going to kind of couple behavioral rehearsal and defining abstract concepts. Accepting correction can be an abstract concept. So with behavior rehearsal, we break that down into, we define it and break it down into steps. So what is accepting correction? Accepting correction means that I stop, I listen to my supervisor, I say okay, ask a question, and then go do it. So what we would do is to take those steps and put them on a card, either visual or written card, and have coworkers, family members, the supervisor, job coaches, individuals, different individuals to come up and ask the person, hey, how do I accept correction? A lot of the time it's very difficult to help someone when they already feel frustrated. And so with behavior rehearsal, you're teaching them how to accept correction on a time where they're not being corrected. So that when they actually have to accept that correction, you could say, just like we practiced, you know, what are the steps? Another one is self-monitoring. This is giving basically the individual a checklist to say, yep, I did all of these things and I did them well or I did them correctly. So self-monitoring can start with your morning routine. I woke up, I brushed my teeth, I washed my face, I combed my hair, and I picked up my ID badge. So that could be you're checking off, you're monitoring that, yes, I did these things. Self-monitoring does not need to be really a schedule checklist like that. It can also be when I went to work, I followed the rules. I only ate my lunch. And you're monitoring yourself on your behaviors as well. Another thing that is extremely important are visual supports. Visual supports in the form of the behavioral rehearsal tool, visual supports in the form of schedules or the self-monitoring list or the first next card that we had talked about before. Schedules can be your entire day schedule. Schedules can be, you know, from the point that you clock in to the point that you clock out at work. And you can also break it down into mini schedules on this is what I do for this particular task. So it's a step-by-step instructions for each task. Again, practicing and having consistency are so critical that it's really important that we educate the team of people that work side by side with the individual with a disability, or just the entire team, so that not only do they understand what autism is, but that they understand this particular individual. Many of the people that we work with might know somebody with autism and feel like they know all about autism, but they need to take the time to get to know this individual and what works for that particular individual. So it's great to educate the team on autism specific, you know, in general, as well as this particular individual uses these supports, which can really come in handy later on for troubleshooting and redirecting to the task at hand. So we really thank you for your time. This is a page that's listed off some resources that we used for this presentation, so feel free to consult these resources. And if you have additional questions, please post them on the web board. Thank you.